Welcome to the IAPB iHealth and COVID-19 web series, where we invite experts from across different areas of health and development to discuss key issues during the pandemic. I'm Jessica Crofts-Lawrence, the Head of Policy and Advocacy at the IAPB. Today's interview is part of a series of discussions to understand the way organisations are responding to the challenges in operating during the pandemic and adjusting to the new normal. I'm delighted to be joined today by Jane Barratt, the Secretary General of the International Federation on Aging, an international non-governmental organisation whose membership includes governments, NGOs, academics, industry, and individuals in over 80 countries. The IFA has been at the forefront of global advocacy efforts for the needs of older people, particularly at the World Health Organization and the United Nations. Jane is an internationally recognised expert on age-related issues. She is a Winston Churchill Fellow and recipient of the Queen Elizabeth II Diamond Jubilee Medal in Canada in recognition of her commitment and passion to enhance the understanding of age issues. Jane holds many national and international roles. She is a member of the Vision Academy, Director of Baycrest Health Sciences, and Chair of the Education Advisory Committee. Jane, it's a great pleasure to have you with us today.
Look, thanks, Jessica. It's a great pleasure for me to be with you, and thanks to IAPB for all of the work that you've been doing during COVID, but also pre and post.
Thank you. Jane, we've heard a lot about the risks of COVID-19 for older people, and we've also heard about the impact that it has had, both on their support and care, but also their perception within society and their ability to stay socially connected. What do you see as the key challenges facing older people during the pandemic?
Look, Jessica, COVID has really brutally exposed not only the most vulnerable people in our society, but healthcare systems that are broken, absent, and really disconnected from the needs of all people and the most vulnerable. But there are three key areas that we as the IFA have been most concerned about when it comes to vulnerable people. And that is the life and death situation that COVID has presented to us. Also, secondly, the vulnerability and neglect that some older people have experienced. And thirdly, the social and economic well-being of older people. I need to just go back and talk about vulnerable people and older people. In the context of the pandemic, and let me remind everybody that we have experienced pandemics in our lifetime. The Ebola pandemic, SARS pandemic, HIV pandemic, but this is the first one that really has had the global impact that we're experiencing today, because every single nation around the world has been impacted, which means that populations of all ages have experienced, the life and death situation. In this pandemic, we know vulnerable people as older people, who have weakened immune systems, but also those with chronic comorbid conditions such as diabetes, respiratory conditions, cancer, and also, what's the other one? Let me think, it will return to me. But these people may be much younger, they may be in their 30s, 40s, 50s, but the chronic nature of their conditions, the non-communicable disease, it means that they're at higher risk of infectious diseases. And so vulnerability comes with age, but it also comes with chronic comorbid conditions. So let me just touch on these three areas, life and death. We know that those who are most vulnerable are those in the 60, 70 and 80 and over age group. And that's because of their weakened immune system. These populations are also at risk of influenza and pneumococcal pneumonia, but we don't have such, the call out for older people to be vaccinated as we do now. The second thing is around vulnerability and neglect, because many and most countries in the so-called lockdown or shelter in place kind of scenario means that many people who are vulnerable have been literally locked down in their home. And a good example is my mum, Billy, who's 92, lives by herself since Dad died 2 years ago. And this has been particularly difficult because not only does she not experience people being around her, but that love and touch of being embraced, has gone. Also, we're experiencing numbers of abuse and neglect far outweighing what we've experienced before. So not only domestic violence, but we're most concerned about elder abuse and neglect. And the stark reminder that those older people living in nursing homes or long-term care facilities, are most at risk, but may also experience neglect and abuse. And the third area of most concern is social and economic well-being. Not only have older people and those vulnerable maybe in loss of employment and loss of finances, they're also experiencing added costs. So the added cost of consumables now at the supermarket. And we hear of the gross impact of scarcity on the price of commodities. So life and death situation, vulnerability and neglect, social and economic well-being. And keep in mind that vulnerable people means older people, but also those with chronic conditions. So diabetes, cancer, respiratory conditions, and I've still forgotten the third one, but we'll leave it at that.
Thank you, Jane, for setting out those key challenges, and very critical and I imagine difficult to address. I wonder if you could share with our members what the IFA has been doing to address some of these challenges and the impact that COVID-19 is having on those who are vulnerable and older people.
Look, IFA is a global NGO, and we have members in many countries around the world. So first of all, if we just talk about, vertical advocacy, so what do we do up here? IFA has been informing the technical guidelines of the World Health Organization around older people and particularly long-term care. And if I just focus on that for just a moment. Now, keeping in mind that by about 2050, there'll be 2.1 billion older people, one would think that there would be a direct link to older people and technical guidelines. That hasn't been the case at WHO until just recently. So through the efforts of IFA in analysing over 75 sets of technical guidelines, we were able to analyse where older people were mentioned and fit in these guidelines. And through that analysis, we were able to encourage WHO to consider the necessity of a portal. So we've informed WHO guidelines, and we've made statements about the importance of older people in the context of decision making, because older people are sometimes neglected when it comes to screening, the testing, the isolation, and the retesting. So test, isolate and trace, that's what they were, test, isolate and trace. So we've informed them. The other thing is, and there's a vast array of things that IFA has been doing, but communication, clear communication about facts and figures and guidelines. So technical guidelines from WHO to a national perspective, and how can we adapt those WHO guidelines. Also very early on, and it was really a reflection, my reflection of how it was to be working in this isolated environment. IFA has 12 staff. We've been working remotely for 15 weeks, and I would expect that to be at least another 5 to 10 weeks remotely. We as professionals and advocates have a strong sense of the isolation. And I'm sure, Jessica, you would agree with me that we're zoomed out. you know, Zoomed out, conference called out, etc. But it was really important for IFA to bring together a platform that offered the opportunities of being connected. So every Friday, we have what's called a virtual town hall, and it's COVID and older people, and we have an expert speaker talking for 15 minutes, and the other 45 minutes is for us to share resources, to ask questions of one another, ask questions of the expert. And generally, we have about 350 registrations every week and about 100 people on this call. And so over the course of some 10 weeks, we built up resources that are particular at a national level, but we've also formed community. And it's this development of community that's most important in these times of stress and de-stress. Because while we're advocating at an organisational level, we're also experiencing personally, you know, the impact of COVID. Some of us may have had COVID, have COVID, or some of our family, and some of our family and friends may have died as a result. So in summary, we work at an intergovernmental level, WHO, UN, informing documents, consultation, and also we work at a national level in pulling through those guidelines and also gaining an understanding of what's happening at a local level through our town halls. So we expect the town halls to continue for quite a number of weeks going forward.
Thank you, Jane. And yes, I definitely share the sentiment of Zoom fatigue, but I think like the IFA, IAPB has really learned that we can reach so many more people through virtual platforms than we did previously. I think our first webinar with the WHO had over almost 1,000 people register, so it was extraordinary. And it's interesting to hear about the work that you're doing with your virtual town hall. I mean, I suppose IFA is unique or different to IAPB in that its membership not only includes organisations but also individuals, and I was really amazed to learn that you represent over 75 million older people across the world, so it's great to see that engagement happening at the community level. I wanted to ask, last week we also interviewed Mike Hoden from the Global Coalition on Aging, which really is the kind of business voice for older people, as you know. And the private sector increasingly plays a role in health and development. And I'd be interested to see what you think the role of the private sector should be during the pandemic.
It's not only during the pandemic, Jess, it's in normal times, you know, if at all there'll be a normal time. The IFA membership is government, non-government, academic, older people and industry. Industry bring a unique intelligence to the table. We have those as members of IFA because that intelligence helps to influence policy. So government, non-government, industry, academic and older people coming together influence policy. And so in all of our meetings, whether it's a conference or an expert meeting, you know, industry is sitting at the table because sometimes they can actually be more responsive to a need on the ground. And we've seen this many, many times during the COVID pandemic, you know, when, and I'll, you know, this crazy example, you know, Yves Saint Laurent, you know, one of the fashion icons, have actually changed, you know, to being able to produce masks. You know, we've seen companies in the field of engineering that have now focused on developing perspex so that people in supermarkets can be safer. So there's industry is able to pivot, you know, as governments are less able to the needs of the community. And it happens at a community level as well as society and national. So industry is a great influencer. It's a great collaborator. It can be responsive, immediate to needs on the ground. It can also be a philanthropist. And we've seen this time and time again. And might I say, we need to go beyond industry too. If we just think about, some of the sporting institutions, that have actually stepped up. We've also seen communities step up. So IFA doesn't see industry as separate. We see industry as one of the key stakeholder groups that helps to influence and shape policy. And the Global Coalition on Ageing, led by Mike Hoden, is a tremendous example of the leadership of industry, but also the partnerships with industry. And so I don't want us to lose trace of the fact that industry partner, and we need to come to the table in understanding how our languages are really about a common agenda.
Thank you, Jane. And that's certainly something that we share here at IAPB. Partnerships is at the heart of everything that we do. And I think, now, especially with the SDG framework, which I'm sure will be the framework for recovering better, partnerships across government, NGO, private sector are at the heart of the delivery of those global commitments. So it's increasingly important. I wanted to turn now to eye health and the impact that it's had during the pandemic. I mean, the eye care sector, like all other health sectors, had to adapt to combat the spread of coronavirus. Many eye health programs have or are on hold, and many eye health workers have been redeployed to fight coronavirus. As the outbreak continues to evolve, we're starting to consider how we might restart eye care services, but also how eye health might support efforts to recover better and ensure that that recovery is as inclusive as possible. I wondered, what do you see as the role of eye health, but also of eye health organisations, both during the pandemic and as we emerge and recover from the crisis?
I think first and foremost, IFA is now talking about living with COVID. This notion that there'll be a post-COVID, I think is now I believe it's quite naive. I think we will be living with COVID for many years to come in a physical sense, but we'll be living with COVID in an economic and social sense as well. And let me explain that. In the midst of the pandemic, and Ontario really is still sitting in the midst of it, you're quite right in that services to people with vision complications has been stopped other than emergency efforts. But we do know that, there are some clinics around the world that have really pivoted, adapted to this emergency situation. And we know of some ophthalmologists in Israel, for example, that go to the patient's home for treatment, injections, etc. At the heart of the ophthalmology guidelines is the safety of patients and clinicians comes first. And so in a strict physical environment, we really are going to see for many months and perhaps years to come, the physical distancing and the safety precautions of PPE, masks, etc. And I say physical distancing in the context of older people because physical and social distancing are two separate things. And so really what we want to maintain is physical distance. We don't want to maintain social distance. So the physical environment will change. Telehealth will continue, as a major spoke in the array of treatment strategies, screening and treatment strategies. Organisations such as IAPB, specifically in the field of vision health, I think it's important that you work across the sector, across the disciplines. And to better understand, as we are doing, is that vision health is a stream that pulls through to healthy ageing. And so how is it positioned within the framework of a person growing older in the healthiest way? You know, IFA talks about how do we create an enabling environment? How do we create an environment that enables an older person to do what they have reason to value? And it's that premise that we need to be going into the future. You know, IFA strongly believes in bringing unlike together. You know, our meetings on vision complications, you know, could involve diabetologists, endocrinologists, public health specialists, as well as those specifically in the field of vision health. So in summary, you know, physical distancing, not social distancing. We are living with COVID, not post-COVID. Our physical environment is going to change. The innovation and technology that we've experienced in response to COVID will remain with us. You know, at the centre is safety for both patients, families and clinicians, so the continuation of PPE, but also the bringing together of unlike so that we can have a common agenda of vision health in the context of healthy ageing.
Thank you, Jane. That was a very comprehensive answer. I feel we need to pull those points out and put them somewhere at the top of our website. And I know that you've been really at the forefront of building those links between eye health and ageing. IAPB and the IFA have worked collaboratively for a number of years, and I know we've worked together with partners such as Bayer and the International Diabetes Foundation on, you know, key eye health sector resources, such as the ER Barometer Project and AMD Coalition. And I suppose my final question is really around that. You know, what do you see as the role of eye health organisations and ageing organisations, you know, working together? You know, what might we best do during the pandemic?
You know, I was going to say there is no option, but there is an option. You know, IFA and IAPB have a strong partnership and a relationship, and I expect that to grow stronger. You know, we have a strong belief in the mission and vision of IAPB. You know, we look at vision health in the context of healthy ageing and what that means to not only the individual, but their family and society. We understand, IAPB and IFA understands the social and economic consequences of loss of vision and vision complications on the individual. So we feel very proud to have an association and partnership with IAPB, with Bayer Global, with IDF, and our mission is to come together with a common agenda and drive that agenda. You know, we see IFA alongside IAPB when you are at the United Nations and World Health Organization advocating for Vision 2020, advocating for the new vision plan around the world. So we are alongside you in that quest to change the environment of policy so that more people have the opportunity to access screening, education and treatment going into the future.
Thank you, Jane, and thank you for your ongoing support of all of our activity. I know you're always a friendly face, but also a key champion whenever I'm at the WHO and the UN of eye health, and I'm sure it's made a tremendous impact on our work and particularly our advocacy activities this year. That brings us to the close of this interview. I just wanted to thank Jane for sharing all of your fantastic insights today, and thank you to those who are watching. We hope that you found this webinar useful, and as I mentioned at the beginning, we have a whole series of interviews and recorded webinars available as part of this COVID-19 and eye health series, and we'll be posting that on our website and social media channels. So thank you very much.